Today's podcast, we are diving deep into the conversation of skin. I've invited a dermatologist on, and I had so many questions for her because I feel like I don't take great care of my skin. I've never been one who's been really fussed about it. I literally have used Vaseline intensive care. You'll hear that story like for years and years. I have really not paid attention, but she has given us some amazing tips on how to care for our aging skin. Dr. Skotnicki is a dermatologist and a member of the Canadian Medical Association, the Canadian Dermatology Association, and the American Dermatology Association, and the American Contact Dermatitis Society. She's been practicing in the Toronto area since 1997 and is known among her clients for being caring and gentle and always abreast of the latest dermatology research and technologies. I can attest that she was so sweet and kind. I just loved this conversation. She answered all of my questions, even personal ones about my own skin condition. So let's welcome together Dr. Sandy Skotnicki. Jumping into summer, which means sunscreen, skincare, and hopefully no burns. But I grew up in the 80s, so I was a product of not using sunscreen very often. In fact, I totally remember going up to my mom's bathroom, grabbing baby oil, and then going into the kitchen and grabbing some tinfoil. That probably makes you cringe inside when you hear that. But that's what it was back then. We just didn't think about sunscreen. Yeah. So what do you have to say about that?
Well, actually, there we grew up a similar time. There wasn't a lot of choice. Like think
No.
about it, when I think about that as just a human being, like, sunscreens haven't actually been around that long. There were suntan oils.
Right.
There were maybe a few sunscreens. I don't even remember. Like, I remember being in residence at university and people sitting outside their window on the roof with
Yeah.
like Ellen
Totally.
reflectors and
The sun was reflecting, so you could get
yeah.
better heat.
I
Yeah.
didn't I didn't partake in any of that, partly because I was just too busy studying or doing something else. I never sat around leisurely out in the sun, which is probably a good thing for my skin. I mean, obviously, sun is does a lot of great stuff, but you don't need that much of it. So purposefully sitting out trying to get color is not recommended by, any physician, including dermatologist. And one of the things I always make sure that people understand about a tan is it's actually your body trying to protect itself. And
Right.
yeah, a tan is about an SPF of 3 to 5. So it's your body laying down pigment to protect the DNA of your skin. So it's not healthy, contrary to popular belief. I mean, that glow and color can aesthetically make you look a little nicer,
Mhm.
but from a health point of view, it's actually your skin trying to protect itself.
I wonder where that came from. You're right, because we all say we feel better, look better with a tan. When did that even start to be a popular thing? And,
I
I wonder when.
I think if you look at the history of like healthcare in particular, medicine, but skin is fascinating. I mean, I think that came along when people had more free time. If you had more free time, that means you were more wealthy
Wealthier, maybe.
potentially. Yeah, and
Mhm.
then you could go away on vacation, and the 80s thing was if you go back to 1940, 50, women covered up. I mean, seeing their ankles was a thrill, right? So, and they had parasols. So if you were tanned, again, socioeconomically, you were more a labor force, right? So if you had pale skin, fair skin, and you were a little bit plump, that means you actually had more money. So it's
Mm.
interesting that some of that, it's funny you brought that up, and I've come sort of full circle, is that it really has to do a lot with your socioeconomic status.
Mhm. Yeah, because I had a client once who was dark skinned. He grew up in India and
Mm.
his parents wanted to keep him inside. So he didn't get to go outside a lot and play with the other kids on the street. He stayed inside, read and studied a lot of books, ended up going to Harvard. But because they didn't want his skin to get darker, he said.
And when I have friends of color and they'll say the most racist people are actually within their own color, because the darker you are,
Mm.
the more like dark skinned people want to be lighter skinned, right or wrong. But
Mm.
and they're very critical of their own color. So and sex, as we know, in India are still flourishing. I mean, they're very much, yeah, how light you are, how light skinned you are is very important to certain ethnic groups for sure. Yeah.
So, in terms of sun exposure, then, what is a good point for us to be out in the sun? How much sun is too much? We know we hear that possibly you should get a little bit of sun without sunscreen initially. How true is that? Should we always be wearing sunscreen? What's your take on all of that?
I'll just digress a second and talk about a sunscreen is a screen and it's not a block. So you're actually getting sun rays through your sunscreen. So if you're outdoors for, hours at a time wearing a sunscreen, you're still getting a lot of sun exposure. So that argument doesn't really hold. And as far as the vitamin D that you need, which you do need sun exposure to produce in our body, because we don't make it organically. You don't need a lot, 5 minutes with your arm out the window kind of thing. Like there actually are some studies, but it's a very short amount of time. So part of the problem with vitamin D with us in Canada is we are indoors for 8 months of the year or 7 months of the year. I take vitamin D supplements. I think it's important too. We could have a discussion about that, partly because I don't think in Canada we get enough sun exposure, but that's got very little to do with sunscreen use.
So, what is the best type of sunscreen then to use? Now, I've heard, well, this is the conversation on social media. Don't use sunscreen because it's toxic and poisonous. Use this type of sunscreen, or always use sunscreen. So, when we look at types and what ingredients are involved, what do you recommend there?
That's a very loaded question. So I'll try to break it down into pieces. And not to pump my own podcast, but I do have a podcast called Skin to It. And we did a very deep dive on sunscreen because in order to really answer that question, it takes a half an hour. Like there's just too many questions. The bottom line is the FDA back a few years ago, I think it was 2020, maybe 2019, from pressure from consumer groups, said, listen, we don't have enough information on chemical sunscreens. We need more. And they did what's called a maximum use study. And actually, I should digress. There's two broad groups of sunscreen chemicals. So one is, they're called chemical filters. So those absorb, think of it like a sponge. They absorb sun and they sit in the surface of the skin and they absorb the sun rays. Then there's physical blocks like titanium and zinc, which most people would know about, and they reflect the light. There's a little bit of absorption too. So we're talking about the chemical sunscreens that are absorbed into the skin. And by the way, that's what the skin does. It absorbs things. It absorbs good stuff too. So the question is, just because it's absorbed and it will then go into the bloodstream, is that a dangerous thing? Because everything we put on our skin is potentially absorbed and potentially goes into our bloodstream. So they did a maximum use study, which was 24 people using chemical sunscreen filters 4 times a day, not going outside and not swimming or exercising. So maximum use study is like going the most amount of sunscreen you could put on your body 4 times a day without like going out and trying to make it come off. And then they examined the amount of sunscreen chemicals in the blood, and they were over 0.5 micrograms per milliliter. What does that number mean? And we were just talking before we got on the recording that taking bite-sized information out of context is the problem with TikTok, and you need a nuanced, longer conversation. So that number doesn't mean it's toxic. It means anything over that amount needs to be studied. Okay. If it was under that amount, they were like, well, the amount of absorption is so minimal that we don't need to study it. Now, remember, again, this was a maximum use study. So they used these, and it was only 24 people, 4 times a day, not going outside. Like, who uses sunscreen that way? And it was over the limit that requires study. So people took that headline. It was like, sunscreen is absorbed into the bloodstream. It's over 0.5 million, blah, blah, blah. It's toxic. So you have to understand what the science is. So nothing was pulled off the shelf by the FDA, nor Health Branch Canada, nor the European Union, which is much more stringent. What they said is, yeah, we need more study. Like everything we put on our skin, even the essential oil lavender is absorbed into our bloodstream. And by the way, essential oils are very complex ingredients. They usually have 50 to 100 individual ingredients. And some of the natural lavender extracts have been shown to have hormone disruptive individual chemicals. So, like H2O is a chemical, water is a chemical. So the argument is this sort of, bite-sized, grabbing headlines, fear-mongering, which is part of the problem with social media, as we know.
Wow, I'm so glad that you shed light on that. I think that is such an important point because exactly what you said, you hear these headlines and sometimes you even see a link to a study, but it's done in a silo, right? It's not the whole picture.
Yeah, you have to understand what the numbers mean. So after that long-winded answer, what do I recommend? I practice what I preach. I use a chemical sunscreen mixed with a physical sunscreen, which is most of the main brands you'd get at the drugstore, right? When I'm like on a beach in Mexico or on a dock in Muskoka. But for day-to-day use, I use a mineral sunscreen, which is just zinc or titanium. The
Mhm.
problem with mineral sunscreens is titanium doesn't really protect against UVA damage or UVA rays. Zinc does, but it has to be a certain concentration. And so part of the problem, and there's no concrete studies, but as mineral sunscreen use has increased, skin cancer incidences, are we actually not protecting ourselves enough from UVA rays? So UVA rays are the ones that go deeper into the skin, are associated with skin aging or photoaging and skin cancer. And so we need to protect ourselves against the longer UVA range. And the physical blocks are okay, but they're not the best. So we want long UVA protection, and you're going to only get that from the chemical sunscreen filters.
So, in terms of skin cancer, then of course that is a fear of many, and it's very popular. I've had multiple family members have already had basal cell skin cancer. I don't know anyone personally who's had melanoma, but we all have the fear. We don't want that, of course.
Mhm.
And so, when you're looking at your body and looking at your skin, and maybe you were like me, who very silly did not wear a sunscreen back in the 80s and 90s, you're diligent now, but then, 20, 30 years later, all of a sudden these spots start to arise. What are we looking for in terms of something that should alert us that we might want to make that doctor's appointment? Something that we shouldn't be leaving.
So again, I'm going to unpack that in various stages. So the most important thing is to realize that family doctors are a really great triage. I
Mm.
mean, presently in Canada, we have 700 dermatologists, It's not enough to do 40
Is
million.
that all that we have? That is so few. That's
So,
why it's so hard to get into. It's like a year wait up here. Yeah.
if you're really, really concerned, even a walk-in clinic, there are some virtual apps. It's a bit more hard to do that with moles, but see a family physician. Most dermatologists, I have a rapid emergency sort of fit in every week. So just to get that out of the way, but to if you don't have concerns or you don't have risk factors, don't bother your family doctor to come and see a dermatologist because there's just not it prevents us from seeing the people that really need to be seen. And I'm going to go over risk factors, but I'll answer your first question is, sun damage is accumulative. I'll have patients come in and say, I wasn't in the sun this year, but I got all these brown spots this year. And it's like every time you go out into the sun, your skin's like a cash register. It's just keeping a tally. You reach a certain
Exactly.
threshold and you start to see the brown coming out. So you can't use that argument. And on the converse, don't get down if you're very diligent with sunscreen and hats, and then you start getting brown spots. As you age and as your cells become older, the damage that's sort of hidden in there or captured in there comes forward. So, and the more sun you have over your lifetime, the more pigmentation you're going to get as you get older. But let's talk about risk factors.
Mhm.
So, I have a lot of patients who will have been seeing a dermatologist for years, and they come to see me. I want to see you every year. I said, well, do you get your colonoscopy every year, or do you get your mammogram every year? No, you get risk stratified, and we determine how often you need to come to see a dermatologist based on your risks. So what are the risk factors of melanoma? Because melanoma is the one you really worry about. Basal cells are the most common form of skin cancer, but they're not life-threatening. They can be disfiguring, but they're not life-threatening. So let's just talk about melanoma. So having a first degree relative with melanoma is an independent risk factor. So that's your, your mom, your dad, your brother, your sister, not grandma, not grandpa. They don't count. People like, my grandma had a melanoma. Well, your grandma grew up when there was no sunscreen, and she got it when she was 80. So that's not genetically important for you.
Okay. Hmm.
Okay. So
Hmm.
that's the first thing I really make sure, because people they want to see a dermatologist. I mean, it's not a risk factor. So first degree relative with melanoma, personal history of melanoma, obviously. Did you use tanning beds? Tanning bed, I see all these, not many, but enough of young girls in their 30s and 40s now who use tanning beds in their 20s. And that's a risk factor for melanoma, especially if you used it for a long period of time. So that's three. Fair eyes, fair skin. So, blue eyes, blonde hair, freckles. Number of moles, 50 to 100. That's a lot of moles. Some people come in, they have like 20 moles and they're like, I need to have a skin check every year. I go, no, you don't. You don't have 50 to 100. And then the last one is dysplastic moles, which is a mole that looks a little bit funny. It's kind of smudged or a little larger. If you don't have any of those risk factors, you do not need to see a dermatologist every year. We would risk stratify you just like your colonoscopy or mammogram and say, okay, you have 2 out of the whatever, you need to come every 4 years. You have 5 out of the whatever, you need to come every year, or like, so I think that's a point I really want to get across to the public, because when you demand to see a dermatologist and you don't have risk factors, you're actually taking up their time, which is taking it away from somebody who actually really needs to see a dermatologist.
I trained a doctor a few years ago, and she would always exercise in bare feet. And so I saw her feet lots. And all of a sudden, one day I noticed that she had a spot on her foot, and it looked quite large. And I'm like, oh, what's that? What's the spot there? And she goes, oh, it's probably cancer, but I literally don't have time to deal with it. And so I
What?
scolded her and we laughed. And she's like, she was very, very busy doctor. And a couple months pass and I'm like, oh, that it's bigger. And now it's like A, B, C, D, D, it's got all the things around it. And her husband in the background said, I keep telling her to go see a doctor. She won't listen. Anyway, she finally, fast forward maybe 6 months from the time that I saw it, said, I'm having a friend of mine who's a doctor come in and test my foot. Anyway, it ended up being melanoma, and she ended up having to have all of her lymph nodes removed in her leg because it had spread. And so just that delaying, if you do see some of these or have those risk factors or do see some of the A, B, C, D, which I'll get you to explain in a moment there, like it's crucial, right? We don't want to put off if we do think it's something pertinent. So is that still,
That's,
are we still looking at the A, B, C, D?
yeah, that's a
Okay.
crazy story. I mean, especially
I
for
know, I know. I was like, oh,
um,
I'd be checking in a nanosecond. But
yeah.
then maybe I'm a little bit fear mongering, like with my own body, like one thing is wrong. I'm like, ah. So I like that you said the risk factors, because that's a good measure for us to kind of go, okay, are we at risk? If not, don't fret so much.
Okay, so I always find that challenging, and I want to, because we have a bit of time here. I love this story from a friend of mine. I have a friend who is a very well-known artist, painter, and she's actually professor emeritus of fine art. And I remember asking her years ago, how do you know a painting is good?
Mm.
And she said, how do you know a mole is good? So there are rules,
Right.
right? There are rules, but at the end of the day, it's like you can't teach that or explain it in 5 seconds. And you know what happens a lot, and I will go through the ABCDs, but what happens a lot is as you get older, you start to get all these other spots. You get sunspots and you get these age spots called seborrheic keratoses, which are new and they're brown and they're weird looking and they bleed and they're itchy and they freak people out. And they're the most common thing to bring people into the dermatologist. But family doctors, as I said again, it depends on their comfort level, but most of them are very good at triaging. Right. So if you have something that you're not sure about and you can't see a dermatologist, go to see your family doctor, and they will, if they're really worried, they send urgent referrals.
Mhm.
And, we try to deal with those as speedy as we can. Okay, ABCDs. Another before I go right into that is one of the ways I explain this to patients is cancer is something that is growing uncontrollably. right? So if you think about nature, like a tree, a bush, a rose, there's such perfect symmetry because it's finished growing and it's symmetric, right? Just like us as humans, we don't have one arm longer than the other because when you finish growing and it's stable, then there's symmetry. So the most important thing about any brown spot on your body is it should be symmetric, which means you cut it in half. Think about a rose.
Mhm.
So if you talk about the ABCDs, it's all about asymmetry, right? So A is asymmetry. So you cut it in half. It's not a mirror image. B is border, which is irregular. Again, that makes it asymmetric. Color, multiple shades of color. Why is that happening? Because the cells are growing uncontrollably. So it's going to start to look like an amoeba, like if there's things jetting out all over the place, which if you cut that spot in half, again, there's no symmetry. So think about what like nature is symmetric, and actually our eye is trained to see beauty to a certain extent as symmetry. Like if you're walking down the street and you see a tree that's missing half of its branches, your eye goes to that and go, "Ooh, there's something wrong with that." It's no different than our moles. So it's not about if they're itchy. It's not about how raised they are. It's not about how black they are. It's about the symmetry.
Mhm. Okay, good. Thanks for clarifying that. I've never been one to care for my skin, especially on the face. Like, I'm not one of those girls who goes into Sephora and spends thousands of dollars on face creams and all of that. In fact, like sometimes people will ask me, "What do you do for your face routine?" I'm like, "Oh, you don't want advice from me because I literally for years and years used Vaseline intensive care after I took all my makeup off. I always wash my face but with water and one of those magic mitts. So there was no soap involved either. So did that. I've upgraded since then to the CeraVe, which is also a cheap cream. This is probably terrible. You're probably going, yeah, that's not great.
No,
But
not
that is literally all I've done. And I'm okay with my skin, like how it is. I'm 55. I feel like it's okay right now. It is aging, of course. It's getting more wrinkles and so on. But I know I probably should up the game, especially in menopause as we're losing some of that collagen and elasticity, right? So, what are some tips for us as we age on how to care for our skin, especially on the face?
right. So I'll just start actually with you brought up menopause and because I think our audiences are a little older. Basically, you lose so much collagen and elastin in the first 2 years of menopause, and I think the study that everyone still sort of references, was the hormone replacement study was done in women 60 plus. So, I think hormone replacement as you approach perimenopause and menopause is important for your skin, just as a little plug there, because I think it's been something that has been under taught in medical schools. And, you can do all kinds of things to your skin, but with dermatologically, but the HRT is really going to help you.
Can I
Um,
just interrupt there for a second? Sorry. Do you mean systemic
so,
HRT or facial
so
estrogen?
Yeah, I had a menopause specialist on my podcast, Marla Shapiro, Dr. Marla Shapiro. I don't know if you know her. And we went through the NAMS, the North American Menopause Society document from 2022. Now, like the system, and I don't propose to be a prescriber. I'm a patient with respect to that. So, they still suggest HRT systemically only for people who have extreme vasomotor, like so flushing, and
Night
trouble
sweats.
sleeping, they can't cope. They're not going to prescribe it to you for your skin. But I'm just saying that as a scientist in the science is that it is very helpful. As far as topical or bioidentical, the NAMs, the problem with that is it's just not regulated. It's hard to know whether the pharmacist is, like when there's no regulation, it's hard for us as physicians to really recommend it. And that goes to also with using the estradiol or estriol on your face.
Mhm.
There's been studies to show it helps with wrinkles and increases collagen production, but we don't know the safety data. and who's formulating it, how much is in there, how much is being absorbed. So when we don't have those safety data, it's hard for us as physicians to really recommend it. Is there some science to show that it's helpful? Sure, but there's more science to show sunscreen, retinol, vitamin C. So why go and put estrogen on your face when you've got other things that have more scientific data to show they're helpful at slowing the biological clock? So on that note, sunscreen, retinol, which is over-the-counter vitamin A in 1% concentration. Anything lower than that, the studies were done on the 1%. And then 10 to 15% stable vitamin C in the morning underneath your sunscreen has also been shown to decrease skin aging and photoaging. So, and if you ask any dermatologist around the world, sunscreen, vitamin C, retinol. Okay. And
Yeah,
if you can
that's easy.
tolerate, yeah, if you can tolerate retinoic acid, which is the prescription strength, the prescription strength retinoic acid is 20 times the strength of retinol over the counter. So it's much more effective at increasing collagen production, decreasing fine lines, but a lot of people can't tolerate it.
Yeah. Could you tell us what retinol does? I've never used it, but someone else on my podcast recently mentioned it as well. So I feel like I would like to go buy some, but yeah, tell us what it does. And yeah, that.
So retinol is vitamin A. When you put it on the skin, it has to be metabolized in the skin to retinoic acid. Retinoic acid binds to receptors in the skin. We have three receptors, alpha, beta, gamma, retinoic acid receptors. And when they bind to the skin, they tell the skin to increase the turnover. So you're going to have the epidermis turnover more quickly. So you're going to have less fine lines and not fine lines, dryness and flakiness. But where you get the long-term benefits, when the retinoic acid binds to the receptors, it also tells the dermis, which is a deeper area where we have our collagen and elastin, to increase production. So you actually have a signal, we call them cell signaling ingredients that tell the skin to actually do something, right? So over the years, you will increase collagen elastin production, and that's why you wrinkle less.
Okay. So even people with thin skin are okay to use something like a retinol?
Yeah, so the whole thin skin thing is like you're not going to run out of skin. Like I sometimes hear people say their esthetician said, "Oh, you're gonna like the top layer of our skin, which is the epidermis, turns over every 30 days." So
Oh, okay.
we have like stem cells at the base of the epidermis. So you're increasing that turnover, so that's where you get a slight increased risk of sunburn. So the epidermis, instead of, let's say, well, this is a pod audio, but it's like instead of 2 inches, it's an inch and a half. Okay, because the retinoic acid has made you turn over the skin more quickly. But at the same time, your dermis can be a little thicker. That's not going to help you with sun protection, but that'll help you with the aging. I think there's too much made of that. I always say to my patients, if you're wearing your sunscreen every day, you don't have to worry about using retinoic acid.
Hmm.
Unless you're near the equator
Mhm.
in Egypt or something, maybe don't use your retin-A when you're there. Like, I don't know. I don't know what to tell people because there's just so much,
Yeah.
again, you know, TikTok headline, like you're going to sunburn if you use your retin-A. It's just about having some common sense.
Right. Yeah. That is what it usually comes down to.
Mhm.
Let's talk a little bit about how our emotional selves and the impact of things like stress, anxiety, even depression, and the impact that can have on our skin and its, development of things maybe like eczema or psoriasis. How do you coach patients who come into you? How do you counsel them when it comes to that? Because is giving them a cream like a Band-Aid? Do you do both sort of the psychological component and the physiological? Is
Mhm.
there a connection?
Oh, there's definitely a connection. And I
Okay,
think
let's dish about this. I like this one.
so. I interviewed a dermatologist who's also a psychiatrist.
Oh,
Double,
interesting.
double board certified, and we talked a lot about stress and sleep and its effects on the skin. So And even exercise. There's countless studies now. So I'm going to just go back to one of your comments about skin disease. So, I think you understand, and most people understand, stress doesn't cause genetic diseases. It can possibly trigger them.
Mm.
But you have to, like, if you have your mom has eczema, you can get eczema. Stress isn't going to give you eczema. You have to other psoriasis and acne. It can aggravate diseases. It doesn't cause. The only thing that stress can cause is mental health issues, and it also drives inflammation, which we're going to come full circle, which is how it affects the skin and other organs. So there's absolutely no doubt that when you have a genetic condition like atopic eczema, psoriasis, acne vulgaris, if you are stressed out, kids in exams, they get more acne, like what is that doing? So we have a lot of studies now that show, and I don't think I need to tell you this, like when you're stressed, your cortisol levels going up, cortisol is going to drive inflammation. A lot of what we know now about disease, this sort of Western diseases, I mean, they even think that dementia is inflammation, or diabetes type 3. Inflammation is driving so much of our disease. And so you cannot discount how stress is driving the inflammatory response. And then, so if you have a disease already and you're more stressed out, it's going to aggravate and drive that inflammation. As far as sleep goes, the same thing. During sleep that's when our body restores itself. And if you don't have adequate sleep, you're going to have more chronic inflammation, and that's going to show on your face, right? It ages you. So I counsel people. I mean, it's tough. Like as a dermatologist, I bring it up, and but it's a challenge. There's a great dermatologist in England who I have a lot of respect for. He sees very severe atopic dermatitis patients, kids and adults, and he has a multidisciplinary clinic. He has a dermatologist, a rheumatologist, and a psychiatrist.
Oh, that's neat. Neat
They
combination.
all they all see the patients. There's actually some studies to show that when you have severe inflammation in your skin or your joints, the inflammatory mediators go to the brain and can affect your mood. So there's a reason why people are often more depressed or have more mental health issues with chronic disease. And it's not just the fact that they're sick. It actually could have a metabolic effect. Like these metabolic inflammatory mediators may be doing something to the brain. So it's important that we look at that aspect as well. But really, it's about controlling the inflammation.
It's just it's an interesting conversation because yeah, they could get a cream or some medication to help control the topical look of the disease or dermatitis or whatever it is. But internally, if that's not fixed, if that's not worked with or managed, it seems like that would just maybe come back.
Oh yeah, you can't like so people will always say, I used this cream and it worked great, but then I stopped it and it came back. I go, okay, well, if you have high blood pressure or you have arthritis and your doctor gives you a medication and then you get better and you stop it, it's the same thing. Unfortunately, in modern medicine, we are controlling disease. We're not curing disease.
Mm-hmm.
The skin's no different. So if you have like, it would be nice to know what the trigger is and why do these people have chronic, eczema or psoriasis. And we're moving along in that direction. But unfortunately, the drugs we have now are so good that it's a bit of a double-edged sword. The drugs are so good, but then you lose sight of the fact that we're basically putting a Band-Aid on all these things. But the
Mm-hmm.
Band-Aid is allowing people to live their life at present, right?
Sure.
I mean, the number of medications we have, they're called biologic medications that are injected, have really changed people's lives. But you're right, if we take them away, the disease is coming back. As far as stress goes, being itchy all the time or being covered in a painful rash is pretty stressful unto itself. So when we take that away, we really do help people. But you're right, it's Band-Aid. So
How often is the trigger? You mentioned trigger, and that's always curious to me of yeah, what precipitated it, when did it start? But how often is the trigger something nutritional?
I don't know that I can answer that question. I don't think anybody has that question, but
Yeah.
we do get a lot of questions. So we discuss, let's just take eczema, for example. So, I see somebody have really bad eczema. We talk about what they're using. We, talk about the medications, talk about the stress. And then they'll like, the last question is usually, and how about my diet? Can I do anything? So again, I come back to, and I've done a lot of reading on this, is anti-inflammatory foods. I mean, there's lots written on it, and it's pretty much what you would think, right? Lots of
Mm-hmm.
greens, lots
Yeah.
of no processed food, decreased sugar, decreased
Yeah.
alcohol. Alcohol is really the sugar. And there's no doubt that when you control the inflammatory response with your diet, you can help your disease process, but you're not going to shut it off.
Mm-hmm. Yeah.
And I
How?
think that's the difference. Yeah.
Yeah. In terms of skin reactions and heat, so again, summer's coming. I've seen and heard a lot of people that when they go into the sun again, some of those skin conditions are exacerbated. I have actually one that when I go into hot water, it seems to exacerbate. I've got granuloma annulare, which
Oh,
I haven't ever been able to get rid of my
yeah.
whole life, but it seems like when it's heated, like especially a really hot bath, a hot tub, it gets itchy and it sort of exacerbates a little bit. I mean, aside from not going out in the sun or not getting into hot baths, is there anything else that can be done for those things?
For granuloma annulare specifically, or diseases that are aggravated by the heat?
Sure. Let's start with granuloma because that's me, and why not get an answer for that?
So that, chalk that, put that up with all the other conditions that we know exactly what's going on in the skin. Like we biopsy it, we can see what's going on. There's an inflammatory response against the collagen, but we don't know why,
I
right?
know. That's
And
weird.
so again, it's a Band-Aid solution. I mean, almost everything we do in medicine
Mhm.
is. Um, so the sun, interesting thing about the sun is that it suppresses our immune system.
Hmm.
So we actually use less often now because we have all these new fancy medications, but for years, and it's still available. We call it phototherapy. It's called ultraviolet light therapy. And it's been used for years to treat skin conditions, in particular psoriasis and some eczema patients. Why? Because the ultraviolet light decreases our immune response. So if you have a chronic inflammatory response in the skin that's kind of quiet, and then you go out into the sun, you're suppressing the immune system in the skin, so that disease process it's like you're I'm going to digress again here. During COVID,
Mhm.
the vaccinations, we started to hear stories. I don't know if you heard that people that have chronic inflammatory conditions like arthritis or eczema or inflammatory bowel disease, when they got the vaccination, their diseases flared. So let's sort of break that down. Why did
Mm.
that? So I like analogies. One of my analogies for the immune system is it's like an army, and there's only so many soldiers. So, and the soldiers are sort of placed all over our body. They're sentinels. They're looking out for bad guys, cancer cells, infectious cells, and they're everywhere. So when you got the COVID shot, it enticed such a brisk immune response. Like all the soldiers kind of went to the field there in your arm, and they left their posts.
Ah,
So all of these diseases had the opportunity to flare. And it was actually really interesting to just understand, how the immune system, I mean, we're going to be learning from COVID, good and bad, for many years to come. So to come full circle with your question, when you go into the sun, you're decreasing those soldiers in the skin. So they can't work as well. And
right.
skin diseases can sometimes get worse and also get better depending on what your condition is and the inflammation that you have. Yeah.
Yeah, that is okay. I love the metaphor. That's very helpful. Just visually trying to understand that a little bit more. I haven't tried natural deodorants yet. Let's go right to the armpit here, but they are becoming a thing, of course, over on TikTok. It seems like all the young girls are using natural deodorants. I'm still right there with my aluminum in the armpit, which is probably not the best, but what should we be doing right now? I find like I'm not sweating or smelling as much as I was in my 30s, 40s. I'm working out still really hard, but I don't know, somehow have the sweat glands changed? And what are we looking for if we're wanting something a little bit more natural? Or should we even care?
So the whole natural thing is marketing. I'm sorry, but if you look at most of
Bella.
the, yeah, most of the sunscreens, like, or sorry, deodorants, yes, they don't have aluminum, but they have a lot of like essential oils. I've seen people get rashes from them. I'm not a big proponent of natural. I've natural anything. It's a marketing term. Okay, poison ivy and arsenic are natural. It doesn't is it's like it's marketing. So what they don't have are some of the it's more what they don't have than what so they don't have the aluminum, they don't have, certain formaldehyde preservatives, things like that. But I don't think they work any better. And I think a lot of it's marketing, as I said. Interesting point about I just interviewed a fellow who's a microbiologist. His interest is the microbiome, which for the listeners, if they don't know, that's the bacteria that live on us and in us, and there's trillions of them, more bacteria on us than stars in the Milky Way. So when you get body odor, it's because the bacteria in the underarm is breaking down your sweat, as you said, the apocrine sweat. And I think that our apocrine sweat does probably change a little bit in menopause.
Hmm.
But what's interesting is if you acidify the skin, so one of the TikTok trends, which I actually can get behind, is using acidic things under the arm. So like lactic acid, glycolic acid, and you have to be careful because they can irritate. But when you acidify the skin, you decrease the organisms that produce the odor.
Hmm.
So you're changing the sort of landscape of the bacteria. Rather than deodorants mask the scent and antiperspirants clog the sweat pores, the aluminum hexachloride clogs the sweat pores. And let's talk a little bit about aluminum. So the thing about aluminum is it's not aluminum straight up. It's most antiperspirants are aluminum hexachloride. So that's six chlorides off an aluminum. They plug up the sweat pores. Nothing's being absorbed. That's actually how they work by plugging.
Okay.
So it's not, I don't have a big issue, but in the court of public opinion, nobody wants aluminum. That's fine. They're being phased out in some aspects. And but the whole natural thing is not necessarily a fan.
Yeah.
I would
So
somebody use a lactic acid under their arms than a natural deodorant.
So let's go into that conversation more about natural ingredients or clean beauty.
Mhm.
What are your thoughts about that? Another thing that is trending huge right now too is castor oil and everything. Castor oil in your hair, in your belly button. Like it makes me sort of go, oh, should I try it? I don't know. I don't want to be left out, but what are your thoughts on that?
The effect of castor oil in scientific studies on hair growth is incredibly minimal. Okay.
Mm,
I
mm,
mean, it's not dangerous to you, but it's very, very minimal. Same with rosemary. I mean, rosemary, they did do a head-to-head double-blind randomized controlled study, which means it's a good study, looking at the effect of rosemary oil versus topical minoxidil, which is a drug that grows hair. And they were too dissimilar. But I don't want to put rosemary extract and oil on my hair, and I don't want to smell like that. So, that's the castor oil and hair growth and rosemary kind of discussion. To go back to the natural, I think the pendulum has swung a little bit. I mean, people do realize that plants can be very dangerous. I mean, we get some of our most powerful drugs and medicine from plants. I
yeah.
mean, have you ever heard of the drug digoxin?
No.
It's a heart medication, and if you took too much of it, you would die.
Mm,
It comes from a flower called
mm,
foxglove, and that's why they say not to plant foxglove near your
right.
pets. If they eat it, they'll die. So this notion that it's natural and it's safer is just a bunch of BS. And also the poisons in the dose, right?
Yeah.
Or that saying, it's a toxicology saying. So um, most of the plant extracts and things that are used, it's mostly for marketing. There is some data on some of them, but a lot of them aren't studied. And this notion that it's natural, so it's safer, is just wrong. I think where natural fits is it's probably, it could be, depends on the company, where they're sourced, better for the environment, but
Mm.
not necessarily better for your skin.
Yeah.
And plants weren't evolved to treat your skin. So a lot of them are not necessarily safe. And I already mentioned that lavender, in depending on where it's grown, what strain, whatever, can have hormone disrupting chemicals in it. And essential oils are the essence of a plant, and they're very complex. Like if you were to take the essence of a human and remove all of our water, that's not one chemical. It's
Mm.
hundreds. So if you take the essence of a lavender plant, that's 100 chemicals,
Mhm.
individual. It's not, so essential oils should never be used straight up on the skin. They shouldn't be used in children. They shouldn't be put in those diffusers and sprayed in the room. I mean, you wouldn't do that with a synthetic chemical. And as far like fragrances is a big, this natural, you said natural deodorant, natural fragrances are a big kind of trend. Most fragrances come again from plants. They're florals, right? And if you want to produce a perfume and you need 30 ingredients, and one of them you might need an ingredient that they have to plant, I don't know, 5 fields to get that one scent that's not synthetically made. So think about the carbon footprint and the sustainability and maybe you had to, the whole palm oil argument is that the problem with palm is it's very destructive to certain, countries because they have to plant so much of it. So it actually, like, there's all these things that people don't think about what comes into sustainability. I'm kind of droning on here, but I feel very strongly that it's a lot of the natural stuff is marketing.
Well, there's definitely more to the story, is what you're saying.
Mhm.
I have fallen victim to, like, I wanted to get rid of all the candles in my house because I heard somewhere that it was all toxic for those fumes to come up and everything that was in the candle. So I went to the diffuser with the natural oils, and now I didn't understand all of that, though. I thought I was doing a better thing.
Yeah, so again, that's where you're not going to get the information in a TikTok. So
Sure.
there's that one actress, she has that skincare line called Honest. It's her name.
Oh, Jessica Alba?
Yeah, and she was saying once on a stage, and somebody sent me a clip, like, do you know what the most toxic, and I don't like that term toxic, let's unpack that after, as in your home is. And she said fragrances, right? And not just synthetic fragrances, it's natural fragrances as well, because they're going to be coming from essential oils. Essential oils are very complex molecule, like multiple many molecules.
Mhm.
So I thought that was interesting, coming from her. And but we've known this as dermatologists, like the number one cause of new onset rashes and irritation in patients when they come to see us is almost always fragrances, whether they're
Interesting.
synthetic or natural. And more often than not, it's the essential oil aspects that
Mhm.
cause problems.
I heard on one of your podcasts you were talking about some detergent that was possibly adhered into the fabric of a ski sock, and it caused a rash on the fellow's leg. That
Oh
was
God,
interesting, and yeah, I wouldn't have even thought.
what podcast? Was that my podcast or another podcast?
Do you not remember that story?
Oh, I do remember the story, but I guess it must have been mine. Yeah, that
Wait,
was a
or you
fascinating.
were being interviewed by someone else, so maybe you were a
Yeah.
guest on someone's podcast.
Do you want me to recount that story? Because it's a
Yeah,
fascinating.
yeah, it's super interesting because we think too, like I've also thought, okay, should I have detergent or scent-free detergent? I like the smell of Gain and Tide because it smells fresh, but is that the best choice for my skin, for my body? So yeah, let's talk about that for a moment.
Well, just to talk about detergent, I personally don't think fragrance. I mean, fragrance. If you look at the history of perfume, per means through, and fume is smoke. So it was something that was an incense, and it was never meant to be put into everything all over the place. You put a little bit of perfume on your wrist or your behind your ear. It wasn't meant to be put into everything. So I don't as a dermatologist, as somebody who, sustainability, I don't like fragrance in all of these other things, spraying it on the counter or in your clothes. And especially if you have skin disease. So as far as things in clothing, and let's talk about that case. Okay, so my interest as a dermatologist, my academic interest or subspecialty is allergic contact dermatitis. So things that you're allergic to that touch you, not that you're eating. Okay, and we're not talking about peanuts and shellfish. That's an allergist. They do prick testing. I do something called patch testing. So we put on the back usually anywhere from 50 to 100 chemicals that you might find in your, like when you pick up your shampoo bottle and you turn it around, all those names on the back, we're testing you to many of those ingredients that have been known and have been shown to cause allergic reactions. So you get itchy, red skin. So I had this guy come in and he was, and I had a resident at the time. I said, always listen to your patient. He said, I'm allergic to my ski socks. And I said, okay, I'm going to be open-minded. Tell me what happened. And he showed me these pictures of his shins, and he had these horizontal lines across his shins and on the calf of blisters. And it looked like where, I don't know if you ski, but if you have a
Sure,
sock
yeah.
on, kind of get these lines in your
Yeah.
skin from the pressure of the boot. And I was like, yeah, it looks like you're reacting to something for sure. So we tested him, and he came up to a chemical called methyl isothiazolinone, which is a preservative that is commonly used in detergents, so laundry detergents and wash off things like body soaps and shampoos. And we had a bit of a sort of an epidemic of people allergic to this preservative in the early 2000s, partly because um, this is an interesting, I digress again, when the public pushes something, so the formaldehyde preservatives are a commonly used preservative in skin health or personal care. And there was a push to stop using formaldehyde preservatives. And so what happened is the manufacturers were like, well, we got to use something. So they started to use more of this methyl isothiazolinone. And then we started to see massive reactions to this, right? So the public pressure sometimes, pushes things like the parabens are now being phased out, partly because of the public, not because they're necessarily bad. We can come back to that topic if you want. It's very nuanced. So this fellow, I said, listen, when you ski, you're probably leaching out the methyl isothiazolinone that was in your detergent, which is trapped in the sock, and you're allergic, you're highly, like he was hugely blistering allergic on the back. He had a massive positive. And so I said, but here's where it gets really interesting. I said, you've got to check your laundry detergent. And he was a very smart, I think he was a professor, very smart guy. And
Mhm.
he emailed me a few times, said, listen, it's not on the packaging. So get this, in North America, outside of skincare, manufacturers don't have to put ingredients on household items on the
Mhm.
packaging.
Mhm.
So he couldn't find out. So I don't want to say the company because I don't want to get sued or something, but he kept calling the company, writing the company and said, I want to know, is this in your laundry detergent? And they wouldn't give the full ingredient list, but they said, yes. Finally, they said, yes, it's in the laundry detergent. So, interesting fact, before 1996, skincare products, personal care products in Canada were not labeled with ingredients. So think
Mhm.
about how far we've come. Like
Yeah.
we didn't even know what we were putting on, and now we've got people lobbying to remove formaldehyde preservatives, which then causes the methyl isothiazolinone allergy outbreak. And like it's just interesting in a short 20, 30 years
Mhm.
how much we've changed.
Do you recommend then to get scent-free laundry detergents? And if so, is there a brand that you would recommend?
So this is I become less um preachy as I've gotten older because I do get pushback, and my co-host on my podcast is not a doctor, and she loves fragrance. And
Mhm.
her argument to me is I don't have any problem with fragrance.
Mhm.
I can wear it. I like it. It makes me happy. It gives me memories of things. It's people like it, whatever. And I'm like, fine, but I don't like it. So, and the one thing I would say about fragrance is you have to also be cognizant of other people around you, because The
Mhm.
fragrances now are so strong and they last so long, and they've made them, there's these things where you have a fragrance in your shampoo and it starts to only emit the scent once you get moisture. So they can last for hours. And
Mhm.
you're sitting there at work beside somebody who it's aggravating to them. So I don't think they should be used in the workplace. As far as laundry, I mean, if I go back to my co-host, she's like, I can use it in my laundry. It doesn't bother my skin. So if you have skin disease,
Sure.
it's the first thing we see. Remove all
Okay.
scent from your laundry because that is a game changer. A lot of times people come in and they've had uncontrolled eczema, and I'll
Mhm.
say, "What do you wash your clothes with, and do you use fabric softener?" As soon as I change that, their skin disease improves. So
Mhm.
from a skin disease point of view, it's a non-starter, no scent in your laundry. Like that's just not skincare 101.
Yeah.
Then the other things is like for your kids, like are you potentially like I also don't want to fear monger, right? If you're going to use scent in your laundry, are you going to expose your kids to toxins? I mean, no, probably not. So I think everything in moderation. I don't think it's necessary, but what I really think is not necessary in laundry and should be banned is those stupid beads.
Beads.
Yeah,
Oh, I know. My
that I
husband loves those. He loves them. I'm like, don't wash them in any of my stuff, please. It's so smelly and he just loves that. But yeah, I don't wash my clothes with that.
Yeah, it's
I
it's
know.
it's a
Well, we get
problem.
caught up. We want to smell good, but then just have a shower, use some soap on your body, make sure that smells
Yeah,
good.
or
But,
use perfume how it was meant to be used. A little dot behind your ear, a little bit
yeah,
on your wrist.
yeah,
Um, and that's all you need. You don't need it in your clothing and your floors and your, spraying in your rooms, the Febreze.
true.
One guy talking about interesting cases. I had a young kid who was just hockey player, AAA, amazing hockey. He was covered, and I'm not kidding you, head to toe in the worst eczema you've ever seen. And his mom we tested him, he was allergic to fragrance. His mom was spraying Febreze in his hockey bag.
Of course.
And he was so allergic to fragrance. And the problem is now he's got a lifelong allergy. Once allergic, always allergic.
Oh dear. Yeah. I know our time is running short here, but I would like to just quickly, and it's probably not a quick conversation, but I would be remiss if I didn't talk about hair loss and that in menopause, but also, there's a lot of people, young women too. Sometimes our hair is our crown, it's our
Yeah.
jewel, and maybe we shouldn't care about it as much, but it really does, and it can make us feel very insecure when we have hair issues. What is going on the head when we are losing hair?
Well, I think the most important distinction is the difference between hair loss and hair shedding. Okay.
Okay.
That's
Hmm.
a huge distinction. There was a great article written by a scientific writer. I really like her for I think it was the Atlantic magazine, or it might have been the New Yorker. And her title was it was 2021. She said, "The year America lost its hair."
Oh,
So yeah,
really?
yeah, it's a great article. I can find it and send it to you if you want. But
Interesting.
basically, I will, sometimes I'm long-winded and I apologize, but the our hair is not necessary to survive, right? If you're
Hmm.
bald, you still can live a healthy life. So when your body is under distress, our hair cycles, we have these anagen, catagen, telogen phase. Anagen is the growth phase, catagen is in between. Telogen is a shed phase. So when your body is under stress, your follicles will be pushed from a growth phase into a shed phase. Kind of like a very rudimentary explanation is your body's shutting down to conserve energy. You don't need hair to survive. So your body's like, how can we conserve some energy? We're gonna shed a bunch of hair, so we don't need to worry about feeding the hair follicles. Okay, so shedding, the number one cause of shedding in women is postpartum. If you ask a lot of women who've had kids, oh yeah, when I had I lost personally, I have three sons, half of my hair each pregnancy. It all grew back.
Hmm.
So shedding is not hair loss. It's semantics, but it's important. So during COVID, if you have a baby, if you've had a surgery, if you're chronically stressed, if you have low thyroid, you're going to shed more hair. That hair has the ability to come back. Okay. What you're talking about, hair loss when you get into menopause or as you get older, is actual hair loss. So that's called androgenetic alopecia or male pattern thinning. women get it as well. So your hair follicle basically miniaturizes. So you have a long, piece of hair that comes down to like a millimeter. So it's called miniaturization, and that's not reversible. So it's lost. And that basically is genetic. So, some men go bald more than others, some women go bald or thin more than others.
Mhm.
You can't change that. We can slow it down with medication. Minoxidil is one of the most effective ways. We're using a lot of it orally now.
Oh,
It works really great. It's very safe. It's very cheap. There are lots of different, I have a whole, not to plug my podcast again, I have a whole podcast on hair loss where I talk about each type, all the treatments. But I really want to make that distinction because we see a lot of women who are referred, like urgent referral, hair loss, like I lost half of my hair. Okay, don't worry. It's going to grow back because it's a shed. So what can you do to help when you have a shed? You see your family doctor, check to see your thyroid. Iron is I think of iron as like the soil, right? So when you go through a shed, you have all these empty, healthy follicles that want to regrow. You need the right soil. So you need some iron. And especially if you're a menstruating woman, it's hard to get your iron stores up because um, you're bleeding it out every month. So that's also why hair loss can be a big problem after you have a delivery because if you lost some blood, your iron stores might be a little low. So, you have that checked with the family doctor. And then if everything's normal, you just have to be patient. It will grow back.
mhm.
Can you speed that up a little bit? Yeah, you can use minoxidil again. We can sort of push those follicles from that rest phase. That's what minoxidil does. It actually pushes the follicle from a rest phase into an anagen or growth phase.
Okay. Okay.
That's why you can bring your hair back faster. But they're very different conditions.
Yeah.
And the reason menopause will accelerate it is because the male pattern balding is sort of pushed, or it's the DHT or dihydroxytestosterone, which is acting on the hair follicle causing miniaturization. So your estrogen and testosterone are sort of in a seesaw. And when you go through menopause, obviously your estrogen's going down, so your testosterone can go up. That's why you get facial hair growth and you can have facial and hair thinning. So HRT can be helpful for that.
Yeah, very interesting. I noticed that with myself and my own hair. It was very thin in my 40s. And I got an IUD to stop the bleeding because I was very anemic and have been for the lion's share of my life. So I haven't ever had great hair. These are hair extensions, FYI. If you're like, oh, your hair looks fine now. No, it doesn't. Actually, it looks better. It looks better because probably about 2 years ago, I finally started to get iron infusions. So I was
Yep.
low. My ferritin was at 2. Then it was camping at about 8. And so
Have any-
finally, yeah, finally, I know I was like barely existing, but finally my doctor said, let's do some infusions. And it pumped my iron stores up to over 60. So still not maybe, on the higher end, but I have noticed, and then I went into menopause. So I stopped bleeding. I got my IUD out. Take iron is better. And I know I've totally noticed my hair thick. Like when she moves my extensions up, I go, look at, I actually kind of have hair now. And she's like, yeah, I can't believe it's gotten thicker and better. So good point on the iron in the soil. I like that.
Mhm. And actually, one thing I would comment, and because the family doctors again aren't going to know as much. Some know a lot, but the thing about iron is it's a very large range. So in Canada, because the numbers are different in the US, it's like normal is 20 to 200. That's a huge normal range. And
Totally.
the other thing is when you take a blood test, that's a snapshot in time. You actually don't know what your iron stores are. The storage. It's like your bone marrow is like the warehouse for the iron. So if your blood test is low, that means the storage is probably low, right? So sometimes I have to, when people have really low iron and they've struggled with their hair for a long time and they're taking iron supplements, but their iron just isn't moving, you kind of
Mhm.
have to push a little bit and ask the family doctor for an iron infusion because
Mhm.
that really it stops the hair shedding, and that sort of issue because it's just so hard to get iron stores up if you're menstruating, and in particular if you're a heavy menstruator and your hair is thin. You don't need to see the dermatologist. See the family doctor and get on some iron.
Yeah,
Yeah.
great advice there. It's definitely worked for me, so I'm happy about that. Okay, we covered so much here today, and I will definitely link her podcast in the show notes because I want to listen to the one on sunscreen and the one on hair, and just kind of go down the rabbit hole on your podcast. So thanks for saying that. You do have a book. Can you tell us about your book?
Yeah. So I wrote a book 2018. Gosh, I can't believe it's that long ago. And partly in response to um with the increase in just personal care products over the last 20 years, I started seeing people referred to me who had rashes on their face and they didn't realize it was from the products they were using. So the book I wrote is really to educate the public on what causes reactions in personal care products, what is allergy to skincare ingredients? What are toxins? That sort of whole issue. Natural, is it better? And also about washing. Like we are a bit too hygienic. Has that caused problems not only with our skin but our gut? With
Mhm.
processed food, or sorry, clean food, clean water. We clean too much. Cleaning is a marketing message. The only thing you need really to do for your health is wash your hands.
Mhm.
Everything else we do to our body is social norms. Okay. And actually, if you look at the history of beauty, it's quite fascinating. Like if you look at the ads from 1940s and 50s, which soap operas were used to sell soap, it was to, if you were clean, if you smelled nice, you'd get a husband, you'd look beautiful. It has nothing to do with health. So the name of my book is called Beyond Soap. So it's looking sort of beyond everything we're doing to our skin to sort of really get at the message of what makes skin healthy. And it's not a lot of washing, it's not a lot of product, it's fewer ingredients. And, I wrote that, what is it, 6 years ago now, 7 years ago. And now that movement is sort of, yes, less is more is
Mhm.
better.
Mhm.
So if you want to take a deep dive on that, it's on Amazon. It's at all the libraries too. Yeah.
And where can people follow you on social media?
My name, Dr.
Yeah.
Skotnicki.com. I'm Instagram. I do a little bit of TikToking. I'm not really loving that part. And then my podcasts and there's a YouTube with the podcast.
Yeah, I will link all of that in the show notes below. Thank you so much for being my guest today. That was a great conversation.
Thank you for having me. And you've got a great thing going too. I've watched some of your workout videos. I've learned a lot. So thank you for that. And you're doing lots of great stuff for women in our age group. So way to go. Yeah.
Thank you. Thank you for joining everyone. As always, go move daily in your fitness, wellness, and nutrition. And we'll see you all in the next Move Daily Talks.